So I was probably doing in-home visits for maybe about a year in Baltimore City and some of the surrounding counties in Maryland as well. So usually not the most socioeconomically affluent areas, but every single time, good people. And it's funny because I actually ended up having some of the things that I learned doing home health visits were some of the things that I picked up that helped me catch my dad's dementia. So it was profound in a lot of ways. I remember seeing patients who were so lonely. Usually they were for the most part, older people that, even when it was time when the visit was over, they were trying to find ways for me to stay, right? And then I remember another time I was there and the phone kept ringing and it was somebody trying to call this individual and scam them, right? So then I answered the phone and I was like, I'm their daughter and stop calling my dad. And, it was at least it stopped for a short period of time. I can't say I made it go all the way away, but at least it stopped for a while. And then discovered things like people didn't know that they had hard of hearing, phones for the hearing impaired, because a lot of folks, older people, they get hearing impaired. So I was able to, identify things like that. Some of the others that I found, the one that in particular helped me with my dad was when I would do medication reconciliation, which would be like look at the medicines and look at the bottles and see is the same thing that's on your medicine list the same thing that I see here. I found this habit that apparently people have where they dump the old pills into the new pill bottle when most of the time they're supposed to be the same medicine. But here's what's tricky about the pharmacy. 1 month your pill might be yellow and square, and next month the same medicine might be pink and oval shaped, right? So do that long enough and you'll look in that bottle and it'll look like Skittles, right? And then you don't know what's in there. You don't know if that's aspirin in there. You don't know if that's the same medicine that's in there. When your doctor changes your dose, but the medicine still comes in the mail, and then you have people taking twice as much medicine as they should be because, well, if they send it to me, that must mean I'm supposed to take it. The logical thought is wrong, but it's a logical thought that gets a lot of people into trouble. Or my favorite was you have the pill box, you take the pills out of the little pill box, you put them in your pocket because I'm going to take them with food, right? I'm going to make my breakfast and this, that, and the other. Well, if your memory's not that great, then you forget. And then the pills never get on the inside, right? When you go to the doctor, you say, yeah, I take my medicine, right? Or they count your pills. The pills are gone. Yeah, you're taking your medicine. Well, why isn't your blood sugar controlled? Or why isn't your blood pressure controlled? Because come to find out, the medicine's never getting on the inside, right? A lot of stuff like that was very helpful to me, or the things where just nuances of language, of things you can see in the home. So I'm sitting at a table talking to a patient who I know has COPD, and I'm asking her about shortness of breath, and she says, no, she didn't have any shortness of breath. And then I think she gets up to maybe get some water. We're in the kitchen, so it's not very far. And she comes back and she's huffing and puffing. And I said, I thought you told me you didn't have any shortness of breath. And she says, oh, this is how it always is. All right, so I need to be more specific in the way that I ask a question, because she gave me her honest interpretation of what she thought my question meant. I thought I was asking, a pretty straightforward question, but we were not communicating. And if I hadn't actually seen her get up, then I wouldn't know. And most of the time when you're in a doctor's office, usually by the time the doctor comes in, you're already undressed, you're already sitting on the table. They may never see you walk, they may never see you, move, and that information could get missed. Found out about lots of things that impact people's compliance, right? Like, if you don't have a ramp to get your wheelchair out of the house, well, you're going to be very choosy about what makes you leave your home. Or in Baltimore City, a lot of the older row homes might only have one bathroom. So for some of my patients who had really bad arthritis, they would only come down the steps one time for the whole day. Because going back up and coming back down was such a hardship that not going to do it. And it really makes you think about some of the things that impact people's outcomes, right? Like, hadn't thought about that. Had a lot of respect for some of the things and the people that I saw. I remember seeing older couple. The wife was, I think she had the hospital bed kind of in the living room, and the husband was not in the best shape, but he was trying to take care of her, and he was like, they refused to go into any type of home because they would get separated, right? There's no, especially when you're on Medicaid, right? There's no double room husband-wife scenario in most nursing homes, and they had been together for 50 plus years, and he was like, I own this home. I worked hard for this home. I'd have to sell this home and liquidate my assets, and I'm not willing to do that. I have nothing but respect for that, right? Like, that's a very lucid, and while it might be easy to say, oh, go get the care that you need or go into this nursing home or those types of things, that's how could you not respect that somebody said, I worked my whole life to own this home, or to be with my wife, or to be with my husband, and I'm not going to live my last days separated or with nothing to show for it. So be it. I really was moved by a lot of the things that I saw. Tons of funny stories. And one time I got out of the car and stepped on a dead rat. Like, my foot squished when I literally stepped out of the car, and it was a dead rat. Yeah, it was. What? It is funny because, for the most part, people are always concerned about safety, in certain types of neighborhoods, but never had a problem. As a matter of fact, most people could tell when I had my little medical bag. I didn't wear my white coat in the street, but they kind of had some, maybe I was wearing scrubs, maybe, I'm not sure. But everybody was always, they would help me find parking, like in the neighborhood, or people would be very, because they assumed that I was coming to see whatever sick member of the community, because that's their community, that's their neighbor. Never had any issues. I mean, sometimes there were critters and bugs and things. I had one bag that I would take. It had a zipper, and then I had some bug spray that I would use too. Like, there's definitely times, I remember one time there was a cockroach rolling around on the lampshade, and I'm trying to talk to the patient, but I'm also keeping an eye on the cockroach. But it good times, right? And then, life comes full circle. All of those experiences I was able to bring to the table and be empathetic and understanding of the scenarios that I'm asking other providers to go into, or facilitating other providers to go into. I understand what the ask is, to go into a stranger's home and not necessarily know who's going to be there, what you're going to see. That's the first time I ever was in the house of a hoarder, was when I was doing home visits. I had some clues when I drove up, and I was like, they have all the yard ornaments. They got every season out in the yard all at the same time, and I thought that was strange. And then once I walked through the door, and I was like, oh, this is a hoarder's house. Like, oh my, there was like a little pathway, and I mean, floor to ceiling stacked stuff. And you would have never known it, because the woman that lived there, she was just as well-groomed and neat, and if she'd have come in the office, nothing would have ever made me say, hey, are you hoarding, years of newspapers in your home that are an obvious fire hazard? Have you stored so much stuff that you now have what was probably an antique, very nice, wooden dining room table that now you only had two little half a corners of a seat for? Nothing would have ever made me ask that question if I hadn't been in the home.